I'm Dr. Brad Bradshaw, and we're going to go over how to treat coronavirus, COVID-19, and increase your chances of survival. We're going to go through all of these, but let's hit them one at a time. Hydration, extremely important. Stay hydrated so you can increase the thinness or liquidity of the secretions and help cough them up and get rid of them. Rest. You need lots of rest, at least 8 hours a day if you're sick, because rest is when you build the building blocks that help fight off this infection. The immune lymphocytes and other things, these immune warriors. Get rest. Also get nutrition. Nutrition is important because nutrition is what allows your body to build the immune warriors to fight off this infection, such as the white blood cells. Mucinex. Mucinex is a great drug for helping thin these secretions. You want to cough up these secretions because COVID-19 frequently causes bilateral pneumonia. And if this pneumonia gets bad enough and hits a tipping point, that's when you get into those 15 to 20% of people that are really, really sick. You don't want to be there. So hydration, rest, nutrition, Mucinex, take it with a large glass of water. Tylenol and ibuprofen helps decrease the fever, but it can give you a false sense of security if you go to the doctor. Tell the doctor you're taking ibuprofen or Tylenol because that might be why your fever is down when in fact it would otherwise be up pretty high. I recommend a pulse oximeter. I think a pulse oximeter can be your best friend. A pulse oximeter tells your oxygen saturation, which normally is between 96 to 98% for most people. If it starts dropping down into the low 90s, you're probably starting to have some problems. If it gets into the 80s, the high 80s, a lot of physicians will use that for a criteria for admitting a patient to the hospital. So if your oxygen saturation gets into the low 90s and starts getting into the high 80s, you should be contacting your healthcare provider to let them know what's going on and follow their directions. Steroid inhalers. Sometimes steroid inhalers are used to increase the ability to open up the airways and cough this junk up, this exudate that develops in your lungs from this coronavirus. A nebulizer with albuterol. A nebulizer is something that takes this albuterol in a reservoir, nebulizes it so you breathe it in, and it opens up your airways. Your doctor may think you need one of those, and if you do, I think they're great for treating these kind of URIs or upper respiratory infections. Oral steroids. Some doctors will add an oral steroid to open up your airways even more, but you've got to be cautious with using those. Again, follow your physician's advice on whether you need an oral steroid or not. Antibiotics. Why on earth would you need antibiotics? Well, unfortunately, a lot of these viral pneumonias in some patients will go into a secondary bacterial infection. In fact, that's what some of these people are dying from. They have this viral pneumonia, it gets worse and worse, and it tips over, and this exudate, this junk in your lungs, is a perfect breeding ground for bacteria. The bacterial infection sets in, and that may be what kills a person. So, consult with your physician. If you're unsure, ask them, maybe just ask them, hey, do I need some antibiotics? What if this is becoming a secondary bacterial infection? Now, if these things aren't working, always, of course, stay in contact with your healthcare providers, but sometimes people get these bilateral pneumonias, they get admitted to the hospital. This can be fatal. You may need supplemental oxygen, IVs, antibiotics, potentially on top of everything else. Follow your physician's recommendations. We've got a much longer video that explains this in much more detail, and I'd recommend you watch it if you want to understand this process even better. I wish you the best, stay healthy, and best of luck. Thank you for watching.